For my return demonstration, I got scenario 2, which includes Mr. Mishu. Um, he's an 81-year-old male who was admitted to the hospital for an MRI. He gets very anxious in small spaces, so he has requested some medication to help him with his MRI. The doctor has ordered lorazepam 1 milligram IV as needed every 6 hours for his anxiety. So I'm just going to walk through what I would do in this scenario. When I first walked into Mr. Mishu's room, I would make sure to introduce myself. I would say, "Hi, I'm Mary. I'm going to be your nurse today and I'll be taking care of you. Could you please state your name and date of birth for me?" So he would say his name and date of birth, and then I would make sure that his bracelet, his medical bracelet, matched with that, which it does. I'd then perform hand hygiene, and I would take his vitals. Since I know that he's going to be getting lorazepam, I would make sure to check his respirations, and then also assess his level of consciousness and see if he's sedated or anything, because lorazepam does cause respiratory depression and sedation. So if Mr. Mishu is already experiencing those before we give him the drug, then we do not want to administer anything that will create those and make those worse. I also know that he's in quite a bit of pain because of his back, so I would ask him some questions about it. I would use the PQRST acronym to get a better description of the pain instead of just asking what it was on a scale of 1 to 10, because I know that could be different for everybody, basically. So I would do that. After that, I would go to the med room, and when I got into the med room, I would do my first med check. So I would check the medication name, dose, and route, and make sure that it matched up with the MAR on Mr. Mishu's charts. So I know lorazepam is a controlled substance, and it's also a high alert drug. This being said, I know that I have to have a second nurse check it before I administer it. So I would have another nurse be in the med room with me while I was preparing this medication. I did some research and found that lorazepam comes in a vial of 2 milligrams per milliliter, and I'm supposed to be giving him 1 milligram. So when I draw this up in the syringe, I will be drawing up 0.5 milliliters of lorazepam. I also know that lorazepam has to be diluted before it's given in the intravenous route. It has to be diluted at a 1-to-1 ratio, and it can be diluted with sterile water, sodium chloride, or 5% dextrose. I'm going to be using sterile water for injection. So I will be diluting the lorazepam with 0.5 milliliters of the sterile water. Before I draw up the lorazepam or the sterile water, I'm going to do my second med check. So I will check the med name, which is lorazepam, and the dose. This is 2 milligrams per milliliter, but I'm supposed to be giving 1 milligram, so I'll be giving 0.5 milliliters, and this is for the IV route, so that is correct. The second thing I'm going to do, or what I'm going to do next, I'm going to perform another hand hygiene just to make sure that everything is clean before I touch the medication. So before I take up the med into the syringe, I'm actually going to wipe the cap of it with an alcohol wipe for about 15 seconds. And then I'm going to take up 0.5 milliliters into my syringe. I'm going to recap my needle for now. And then I'm going to do the same thing for the dilution. I'm also going to wipe the cap for about 15 seconds. I'll take a different syringe and I'll drop 0.5 milliliters of the sterile water. I'm going to recap that. Before I mix the two solutions, I'm going to have my nurse do my check on my medication. So she's going to check my lorazepam to make sure that it's 5.5 milliliters. She says that's all set. And I'm going to have her check my dilution too, because when you're diluting lorazepam, you don't want the dilution to be any more than what the medication is. Says that's all set too. So what I'm going to do next, I'll uncap them. I'm going to inject the dilution into the lorazepam. I'm going to take this and put it in the sharps. And I'm also going to take the sterile water that I didn't use and I'm going to waste it. And my nurse is here to witness it, so we can assure that nobody's taking home extra medication or anything like that. So I'll recap the syringe. I'm then going to invert the needle a couple times until the mixture is all mixed together. So we have one solution, a homogeneous solution. And then when I'm done with the mixture, I'm going to make sure that I label my needle because it is a high alert and high risk drug. So I'll write that on the sticky note. I'm going to write the name of the drug, which is lorazepam. The dose that I'm giving is 0.5 milliliters. And I'm also going to include that it's diluted with sterile water, 0.5 milliliters of sterile water. And then I will also initial the bottom of my label. Alright, so now that I have done the mixing of my drug, I'm going to go back to Mr. Mishu's room. I'm going to take the vial because I want to be able to scan it when I get into his room. So yeah, I'll go to his room. When I get back to his room, I'm going to perform another hand hygiene, and I'm going to go over to his bedside. I'll check his bracelet again, make sure everything's right. And when I get to his bedside, I'm going to do my third med check. So I'll have my vial and my syringe here. I will check that it is lorazepam. It's a dose of 1 milligram, and it is for IV use. So that is correct. So it is okay to give to him. Matches his MAR. Before I actually give him the IV drug, I'm going to flush his IV to make sure that it's patent and that it's okay, that he doesn't have any pain with it. So while doing that, or before doing that, I'm actually going to take his IV and wipe it with an alcohol wipe for about 15 seconds, just like I did to the vials before in mixing the meds together. I will take my IV flush and I'll tell him that he's going to feel a little bit of pain, but it shouldn't last that long. But if it does continue to last, then I want him to tell me. So he had just a normal amount of pain for that. I'm going to discard this in the sharps container. And then the last thing I want to do before giving him the medication, I want to make sure that he understands what it is and what its for and what the side effects are. So I'll ask him, Mr. Mishu, you're going to be getting lorazepam. Do you know what this med is? Do you know what it does? If he says that he does, then I won't explain it to him. But if he says that he doesn't, then I'll explain that lorazepam's a benzodiazepine. It's most commonly used for as an anti-anxiety med or to help reduce the risk of seizures. So we're giving this to you today for your anxiety. It should help you be more calm when you go and get your MRI. So I'm going to inject it into your IV, and it does have the side effects of drowsiness, sleepiness, dizziness. It can cause some respiratory depression, and it could also cause some sedation. So you're probably going to feel a little bit out of it, maybe a little tired. We're going to monitor you to make sure none of that gets out of hand, to make sure you don't get too heavily sedated, and to make sure that your respirations aren't too shallow or too depressed. So do you have any more questions before I administer this medication to you? And he'll say no, and I'll be okay. So I will scan his medication. I will also scan his wristband, and by doing that, I have ensured in the MAR that I have given him his meds. So now I'm going to actually wipe his IV one more time with alcohol for about 15 seconds. And then I can uncap the syringe, inject it into the IV, recap the IV, cap the syringe, and then discard the syringe into the sharps container. And before I leave the room, I will ask him if he has any more questions, and he doesn't, so I'll say, all right, I wish you the best of luck on your MRI. I'll be back to check on you later.